Hello, everybody. I am Dyan Ferguson. And first of all, I just want to say a big, big thank you for having me here today. This is a topic that I'm so passionate about, which is our mental, emotional, physical, and spiritual well being. I am just so passionate about all of us being able to live the best lives that we can, being able to be happy, at ease in our bodies and in the world. So, thank you so much for letting me be here today just to share what I'm most passionate about. So, what I'm going to be talking about today is trauma. And it's a difficult topic, but it's so important. And it's important because for two reasons. One is it's so prevalent in the world. Frankly, it's very rare that somebody has not had some trauma in their life. So, first of all, it's prevalent, it deeply affects our lives. And the second reason is there are new technologies, I like to call them technologies, modalities available today that completely change our ability to transform trauma. This is so important. And I'm just so passionate and fired up about any opportunity I can get to talk more about what we can actually do. So, what we're going to do today, what I'm going to do with my time today, first of all, I just want to raise a little bit of awareness about what trauma is, what it looks like in our day to day lives. But mostly, what I want to talk about is what do we do? So, if you know you're living with impacts of trauma or members of your family, what can we do about that? And then I'm actually going to take us through a little guided exercise of what life is like living without the impacts of trauma. And then at the end, I'm going to talk about how anybody who's listening to the live stream or the recorded version later, anybody part of the summit can get a free demo, a free experience of a new modality that treats trauma in ways I have never seen before. So really excited to dive into this with you today. So first of all, who am I? Again, I'm Dyan Ferguson. I am a certified MAP practitioner. I'm going to talk more about what that is. I'm an intuitive transformational coach. And of course, I became a coach because I've been so passionate about mental and emotional well-being since I was very young. And that's because I, as you might imagine, grew up in a trauma ridden home. There was a lot of mental illness. My parents had experienced severe trauma themselves. So there was trauma, there was mental illness, there was a lot of abuse of all kinds in my home. So that was my childhood. And I grew up in a country that has extreme levels of societal and generational trauma. I grew up in South Africa. Um, I'm a first generation immigrant. That brings some trauma. And then, as a way to escape my childhood, I joined the Army. I spent 7 years in the active duty military. So, guess what? I got to experience and see a lot more trauma during those years. So, a lot of trauma in the first half or whatever third of my life. And then I spent 2 decades trying to resolve trauma, trying to feel some sense of peace and ease in my life. I of course, tried therapy and counseling, energy modalities, just everything I could find. I spent a lot of time practicing mindfulness and meditation. And these modalities work, they helped, but they are slow and they can be painful. So, again, this is why I'm so excited to talk about just where technologies, where modalities are today for treating trauma. So, my guess is that many of you listening live or later, again, just because of statistics, have experienced trauma in your own lives. So, maybe you experienced that personally in your childhood. That's the most common. Most people experience that. Of course, you may have experienced as an adult too. And then what I really, think it's important to talk about too is there isn't just the trauma that happens to us. The trauma that happened to our parents and their parents gets passed down if it wasn't resolved. Gets passed down emotionally and physiologically. Of course, trauma is in the body. I think that's a pretty well-known fact. So it gets passed down by our parents, our ancestors. And then, of course, there's trauma in our community. And now that we're such a globally interconnected world because of the internet, we are also impacted by the trauma in the world. So first thing just to name here is that if you have experienced trauma in your own life, you are going to be much more susceptible to trauma in the future. And this is a well-documented fact, especially around veterans. And you're going to be very susceptible to secondary trauma. So I say this just to say, if you have experienced trauma in your life, you're living with the impacts of that. Waking up these days, reading the news, looking at what's happening in the Ukraine can have a deep impact on you. And these are the things that we don't talk about or we just push away. And of course, right, our hearts are with Ukrainians. So that's where the suffering is really happening. But it is important to name and acknowledge if that is happening, if it's bringing up things in you, if it's bringing up your own trauma. So again, this trauma happens all around us in all these different ways. So let's go a little bit deeper into trauma. And again, purpose of this part is just to raise awareness for those of you who might not realize that you're still actively living with the impacts of trauma. So, mental health, right, is always on a spectrum. So we're always looking at, we all have bumps, we all have bad days, we all have unpleasant feelings, but it's always a question of intensity and frequency. So, just notice if you're experiencing some of these well-known symptoms of trauma. So, how much anxiety do you feel? How safe or unsafe do you feel in your life, in the world, in general? Do you notice that you have any hypervigilance? Is this constant sort of checking out, am I safe? What's happening in the world today? What about powerlessness, hopelessness, helplessness? Again, it's a matter of degree, but these are very, very important signs of trauma. What about depression? Some or a lot. And depression is actually the consequence of just ongoing powerlessness. That's where it will end up. What about just day-to-day irritability, reactivity? How much does that come up for you? What about anger or rage? And another really important area to look at, which I'm also very passionate about, is your relationships. How easy or how difficult are your relationships? Is there a lot of conflict or is there ease and harmony? Is it hard to find people to get along with? Is it hard to express your needs? Any of these sort of challenges with relationships are often a result of trauma. So again, what we're talking about is the frequency and intensity of those feelings. And another way to sort of assess trauma in your life is when some of these feelings come up is, do you have a sense of losing control? So, before I explain this, of course, I want to say we're always responsible for our actions, but the experience of loss of control in the moment is absolutely real and is a function of trauma. And I want to just talk a little bit about this. Sort of leads me into what is trauma? How do we define trauma these days? So I think the good thing is that the definition of trauma has become more broad, and this is appropriate, right? So how we define trauma these days is any event or circumstance that happens in your life that you do not have the emotional and mental capacity to stay present in or to process, right? It's just too much. That feeling of this is too much. I can't handle this. I can't get my arms around it. I can't process it. It's too much. So what actually happens when we don't have the capacity is we dissociate, whether that's for a moment or minutes. And what we mean by dissociate is we disconnect from our rational adult mind. So we go into this disconnected state. And then what happens? So that event, that circumstance, which is now a memory, you were dissociated at the time of the event. Now it comes sort of a piece of disassociated consciousness or disassociated aspect of you that sort of just hangs out over here until or unless at some point it's resolved. It just hangs out. And by the way, I'll just note that when we have a lot of trauma and therefore a lot of dissociated memories, it takes energy. So this is where we start to experience physiological consequence experiences such as fatigue, for example, but the list is endless of what we can experience with. There's a lot of trauma and a lot of dissociated memories. So, so another important thing to name when we're talking about how trauma works, so this might be obvious to you, but it might not be, is that I've heard it said this way, and I sort of like it. The mind is kind of lazy. So what the mind constantly does is in every moment when we're having an experience, it references past experiences to decide how to respond now. So here's the problem. If we had a certain experience, and often, as I said earlier, often trauma happens earlier in life. So maybe we were young and we dissociated. Now, every time a similar event happens in our lives, we're going to go back and we're going to reference that earlier memory, and we're going to reference a dissociated memory, right? And if we were young when that happened, we're also referencing a young consciousness. So what can happen? So now I'm referencing that, my mind's using that as a way to make a decision or take an action now. So, and it's dissociated. So this is what can create this experience in the moment of I don't have control. So just, and I know most of us have had this experience, right, of having so much emotion come up in a moment, whether it's grief, sadness, fear, or anger, that we don't have control. So again, of course, as adults, we're responsible for our actions, but it's really important that if we are experiencing impacts of trauma and dissociated consciousness, it's important to acknowledge that this loss of control is real. And because when we acknowledge that, then we can actually take some appropriate action with that, right? So what I want to do next is just take a little bit closer look at your life. Or, you might also, if you're a parent, look at the lives of your child as well. And you feel free to skip this if this feels triggering for you, but just looking at the level of trauma that you might be living with in your life. So just taking some deep breaths into just feeling your feet on the floor for a moment, getting into your body. And the more, by the way, we just take deep breaths, come back to ourselves, get into our body, this actually expands our capacity in the moment. So as we start to talk about trauma, it's really helpful to do that, to just take a moment, breathe, expand our capacity, get a little more grounded, feeling more of ourselves. So I want you to just think now about your day-to-day life. And this is just for you, just for your own benefit. But how much stress and anxiety do you feel? How many days out of the week are you stressed or anxious? And when it's at its highest point, how intense does it get? And I like to just use a little rating scale. So 10 being the most intense feeling that I can imagine, 1 being completely peaceful. How intense does your stress or anxiety get? How often? What about reactivity? So how often do you find yourself reacting to others or events? Maybe it's in traffic, maybe it's to your boss, maybe it's to a family member. How often do you find yourself feeling reactive? And again, how intense does it get on that scale of 1 to 10, 10 being the most intense? How often do you feel angry? And for many of us living with trauma and in a state of managing it, anger can be buried too. So you might just notice that. Is there anger that comes up, or is there anger that's buried that you're aware of? How intense is the anger if it comes up? Is there any sense of loss of control when any of these feelings come up? And how about powerlessness? How often do you feel that way? Powerless, helpless, hopeless, whether it's about circumstances in your day-to-day life or the world? How often does that come up? How intense is that for you? And what about relationships? How comfortable, how easy are your relationships or not? How many of your relationships feel difficult? What's the level of discomfort or difficulty that you feel? So I know, and then actually, lastly, I don't want to skip over this one. What about health? Do you have chronic health conditions? More than one? What's the level of pain and discomfort? Chronic health is often connected to trauma. So, the purpose of doing this exercise again is just to raise awareness, but also to really encourage you, if you are living with these behaviors, these big emotions, is to get curious about what you can do about this. So let's also just check in. What are your coping strategies now? So if you know you're living with the effects of trauma, are you getting support with that? How do you work with stress and anxiety? Do you have tools or practices, or do you just, shove it down on a day-to-day basis? How are you working with that? Do you have ways to safely express powerlessness, frustration, anger? It needs to be expressed in contexts that are safe. And again, just to raise awareness, or if you don't have good coping strategies, are you perhaps self-medicating in certain ways? We do that with, of course, with substances at the far end of the spectrum, but also with TV, just ways that, or overworking, ways that we distract ourselves to a very high degree. That's a way of self-medicating, of ignoring, of being in denial. And, I also really want to say here that it's really important not to shame or blame ourselves, because my passion and purpose in being here today is to say that there are new ways of working with trauma that are just still getting traction, becoming known. So it's becoming so much easier and more possible. And it hasn't been that way in the past. The ways of working with trauma haven't always been accessible, and they haven't been easy. So please, if you're sort of resonating with anything I'm saying, please don't shame or blame yourself. This is just to encourage you to explore the possibilities of ways that you can work with that and transform your life. Okay, so now let's shift gears completely. So let's start talking about what we can actually do. So, of course, there are many things that we can do in our own day-to-day lives. And of course, back to, I love the summit, because at the heart of it, that's what the summit is about, this self-care. So many things we can do. But number one, which is again why I'm here, is we need to educate ourselves on what we're experiencing. Is this trauma? Let's educate ourselves, educate those in our family or in our communities, and acknowledge it. Acknowledge it so we can take appropriate action. And by the way, one very important appropriate action, as we acknowledge that this is trauma, is ways of creating safety in our lives rather than pushing through trauma. Often what we do when we're not fully aware of it, we push through. That can have the consequence of re-traumatization. So it's really important to educate, acknowledge it, create safety so that we don't re-traumatize ourselves. Naming it in the moment. So going back to what I was saying earlier about those moments where we feel a loss of control. So this is essentially a mindfulness practice, is learning to name it when it happens, just as quickly as we're able. It won't happen right away. That's the nature of trauma. Dissociation happens. We're not in our rational mind, but as soon as we come back, we want to name, oh, that's what's happening. Name it for ourselves. If it feels safe and it's possible, naming it with loved ones. This is what just got triggered for me or activated. This is what's happening. And so the possibility of naming it partly gives us a sense of some control over it, but also encourages us to approach it with more self-compassion rather than judgment. Judgment has never helped anything. So the more self-compassion we can approach this with, the better. So those are just so educating, acknowledging, naming it, self-compassion. And now we get into some actual practices. So there are lots and lots of practices we can learn to do on our own. So of course, and these are practices that will just dissipate the big feelings that get activated. So of course, the number one, everybody I'm sure has heard this at some point in your life, but the breath. Right, this is the breath that gives us life in every moment, but is also the most effective tool there is for any big emotions, but certainly for trauma. So, the act of taking long, slow inhales and exhales is life changing. So, this is something we all should be doing often. So many things happen when we slow down and breathe deeply in and out. And there are different breathing techniques. So you can Google that. You can probably spend days Googling different breathing techniques, but the basic one is 4 long, slow inhales, slow exhales. But at the top of the inhale, you want to pause. So maybe you take 4 breaths as you're breathing. I'm sorry, breathe in over 4 counts, hold for 4 counts, breathe out for 4 counts. So doing that until you feel a little bit more ease is incredibly powerful. So breathing will slow down your nervous system, slow down your heart rate. That will slow down thinking. If you can add to it, start listening, just really listening, just literally with your ears, feeling what breathing feels like. Now that has the additional effect of getting us back into our body, which gives us more capacity and distracts us from thinking those stressful thoughts. So, breathing, listening to it, feeling it, feeling our feet on the ground, adding some grounding to it. This is the most effective thing that we can do when we feel activated by big feelings of any kind. So just taking this pause to do that. So in addition to breathing, of course, then there's meditation and mindfulness. These just over time train our brain to shift away from difficult, stressful thoughts into our body, into more peaceful thoughts. So this is a very, very good coping mechanism. And then, of course, movement practices are very, very good at grounding, getting us into the body again, slowing everything down, creating more capacity. So this is really at the heart of yoga. And also just walking. I mean, if it's just stretching, any sort of movement can have this same effect of grounding, especially when we bring this intention to it. So these are very, very easy things that we can do in any moment to regulate our nervous system, to bring down big feelings, to relax everything here. So frankly, even if you don't have trauma, you're not living with the effects of trauma, these are practices we should all be doing. So these are just some day-to-day practices. Again, I'm just going to say it again, starting with educating ourselves and acknowledging that trauma is real and that we might be living with the impacts of it. So now let's talk a little bit about the kinds of professional help that are available. So, earlier I had you just look at the intensity and the frequency of trauma in your life. So if you're noticing that it's high, that it's unpleasant, that it's uncomfortable, that there is a sense of having control, that it's affecting your quality of life, then of course it's appropriate to get professional help. Yes, 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 yes. And again, now that there are more modalities and possibilities, it's really important to do that. We don't have to live in these difficult states of being that are the consequence of trauma. So, if you're going to look for professional help, so of course there's talk therapy. So that's been around for a very long time, and it's been around for a long time because of course it works. It works. However, I will say from my own experience and perspective at this point, especially as a professional, but also personally, it works, but it's slow. And sometimes we have to relive trauma as we tell our stories. So that makes therapy slow and sometimes difficult, albeit effective. There are today a lot of modalities that are body oriented, and sometimes they're both talk and body oriented. or they're just body oriented. My favorite on the list of body oriented therapies is called somatic experiencing. So, trauma is stored in the body, and in this modality, the practitioner will take you into your body in ways that allow the trauma to be released from the body, but in ways that feel safe and manageable. So, this is of all the recommendations that I could make with in the professional realm. This is my second highest recommendation. Of course, I'm going to tell you what the first is in a minute, but this is my second highest. I think it's very effective, and partly because it's very effective at getting to the deeply rooted trauma in the body and not necessarily having to relive the trauma through talking about it. So, my third recommendation, if you're looking for professional support, is these days it's people are using a label trauma informed therapies and modalities, and I like this label because not all mental health professionals have experience and training with trauma. So I think it's important to look for someone who does, and so you can look out for that label trauma informed. So those are just some sort of basic recommendations about professional help that's available. But now I want to talk about what I'm really excited about and here to talk about today. So, again, I just like to use the word technology, these new technologies or modalities that are now available. So, maybe you've heard the term rewiring the brain. So, I'm going to talk about that. Now, this is new terminology. We're talking in the last 10 years. So, when we say rewire the brain, there's different levels of that. So I just want to name that first. One level of rewiring the brain is when people talk about neuroplasticity and creating new neural pathways. So we're saying that the brain is malleable, our memories are malleable, our thoughts are malleable. That's what essentially the short version of neuroplasticity. And so what we can do is create new neural pathways. And essentially, I think most people are familiar with this technology, but there's the path most taken, right? That's the neural pathway. This is just always how I respond. And you may remember what I said earlier is the brain is lazy. It always references the past to decide how to respond now. So it's just going to go down this path that's easiest, that's most accessible, that it takes most often. That's a neural pathway. And so when we're wanting to create new responses, new patterns of responding, new behaviors, we can think of that process as creating new neural pathways. But again, this is slow and it's difficult, right? How many of you have tried to take on a new habit? It's slow, right? And it takes discipline and hard work. I don't know about you guys, but trying to make myself get out and exercise or eat better. Wow, it's hard. It's hard work. So that's one level of rewiring the brain. And so now I'm going to tell you that there's a new level of rewiring the brain, which is different, much faster, much more effective. So, and at this level of rewiring the brain, we are coming back to neuroscience. So neuroscience is completely documented again that the brain is malleable, memories are malleable, we can change our memories. So again, we're always referencing memories for how we act and show up now, and we can change those memories. And I want to just say, just notice, everybody listening to this has done it at some point in your life. Just notice, maybe most of us aren't aware, so you probably weren't aware that you were doing it, but just notice when you are telling somebody a story, you're telling them about something that happened to you yesterday or a week ago. Actually, so let's take it a little bit further in the past. So when we're telling something that happened yesterday, we're most likely trying to remember it exactly as it happened. But let's say a month has gone by and you're telling the story. Just have you ever had that experience where your perspective suddenly you realize is different on that event that happened to you? And so all of a sudden you start telling the memory differently. You start describing it differently. So in that moment, when you describe that memory differently, you are changing the memory. That's what's happening. And the third scenario is, let's say it's a very old memory and it's kind of vague, right? Sometimes we might just say, I don't really remember. In other moments, we might try to fill in some of the blanks. Guess what? We are now changing the memory, right? We just added information into the memory. So this is generally what we do with memories that aren't that intense, and we do it on a day-to-day basis, right? So this is very normal. So again, neuroscience is, you can see it in your own life. It's documented by neuroscience. So, but in neuroscience, what they say is that when we retrieve a memory from long-term storage, because it's not active, so we're retrieving the memory, there's a period of time that we have to change the memory. And it's called the window of reconsolidation. It's a limited period of time. So now when I'm saying that there are these new modalities that can change memories, they're leveraging this technology, or this neuroscience, shall we say. You and I on our own are unlikely to retrieve a traumatic memory and try to change it. Mostly we're going to stay away from that, right? But so this method that I am now certified in, I'm a certified MAP practitioner. This new modality, it does exactly this. It in a safe space, we retrieve a memory from long-term storage, a traumatic memory, and just enough to actually retrieve it and bring it into your conscious mind. You do not have to fully relive the memory. We just basically have to open the door to it. That's about it. And now what we do is we create a condition where we feel safe, relaxed, because we're not going fully into the memory. And so we create the conditions to change those traumatic memories. And essentially what we do, so again, we're not creating neural pathways. What we're doing when we change this memory is we are dissipating and often full on neutralizing the elevated emotional response that was attached to that original memory, whether that was big fear. Mostly it's big fear. So we can significantly dissipate, if not fully eliminate that when we retrieve that memory. This is what's possible now. So now I still, of course, have the memory. It's still present, but it doesn't have that elevated emotion. Now the consequence is I can stay present with the memory because it feels essentially neutral, or there's minimal charge or emotion to it. Now this consciousness, this dissociated consciousness that was hanging out over here, is now integrated. So I have the memory back. I can access it from my adult consciousness. And here's the best part. Next time some similar event happens in my life, guess what? I can make a new choice from the mature adult consciousness that I have today, not from a young consciousness or whatever age it was when that original trauma happened. So I can live in a more integrated state. I feel more ease. The memory doesn't just, I can feel more ease around the memory in particular, and I can make new choices and show up differently in my life. So this is what I mean about being able to live in a new way with trauma. This is completely different. Somebody said, what was the name of this modality again? It's called the MAP healing method, and MAP, it stands for Make Anything Possible. So that the creator named it that way. The person who developed the modality, that's what she named it. So you can certainly Google the MAP healing method. I'm going to share a little bit more about it and how you can experience it. So let's see. So what does this mean for you as a client? So when you're experiencing the MAP healing method, so you come to a session, you decide what memories or experiences or big feelings that you want to work with. And again, minimal having to remember or relive or talk about it. We just want to open the door to it. And your practitioner is going to make sure that you don't fully bring it up and go into a re-traumatized state. We're going to make sure of that. We'll put you into a relaxed state where you're feeling safe and comfortable and in control of what's happening. Sorry, I just lost my spot for a moment. Sorry, and I just remembered. And so, with this map healing method, there's an additional piece to this process. So, this is genius. So, what we actually do, we actually instruct your own subconscious mind to reduce that charge and change that memory. So, your subconscious mind is actually doing the work all by itself. So, you're fully in control of the process. So, how quickly or how long does this take? It depends on what we're working with. So, some things we can shift in one session, 1 hour. It's possible. So you will in a map session always feel and experience something shifting. So if it's a smaller trauma, you can potentially shift that in one session. If a bigger trauma, it might take a few sessions. If it's something that's been recurring over the course of your lifetime, which does happen because it's sort of another way in which the mind works. Sometimes it continuously recreates certain experiences to try to resolve it. So we can find ourselves recreating traumas over and over. And so when we're working with something like that, it can take a few months. So that can sound like a long time until you compare that to years of therapy. Right, I was in 10 years of therapy, and the results I got with MAP were a fraction. So let me. I like to just share my own experience and can share other experiences of clients too. So when I first discovered MAP, I did not think this was real. Did not think this was possible. I was a skeptic. I am not gullible when it comes to these things. So I was curious. I was convinced to check it out, and I experienced a memory shifting in the very first experience of it. And it's a life-changing experience to see that happen, to see a memory go from really charged to neutral. So I became very passionate about MAP, and I had very high levels of anxiety. You heard about my trauma earlier, had very high levels of anxiety. Within 3 months, my anxiety was 95% dissipated. Can you just imagine just what a life-changing experience that is, to not be worried all day, to not be managing? I used to get up and meditate every single morning. I had to because there was so much anxiety. I would meditate multiple times a day, just a way to try to manage, stay present, stay calm. I don't do that anymore. Now I just meditate because it feels good, or other reasons, but not to manage anxiety. And I've been able to resolve other traumatic events from my childhood. So again, I'm in a position to make new and better choices. My relationships are better, and I'm doing work that I love. Life is so much easier. This is what's possible. We do not have to live with trauma anymore. And so now, of course, I don't want to do anything else with my life other than be a MAP practitioner and offer this to others. So I get to witness these miracles every week. So, just on Monday, I've had someone I've been working with for a couple months, and she's had a lot of trauma, and we worked on, actually on Monday, we worked on hypervigilance, and she texted me, on Tuesday, and she said, I slept more than she could remember in a very long time. So I get to see miracles like that, people feeling more capacity, more ease, less anxiety, making new choices, bringing new opportunities into their lives. So this is what's possible. And again, at the end, I'm going to offer anybody listening, live or afterwards, a free experience of this. So stay tuned, and I'm going to be talking about it at the end. So so that's essentially the MAP healing method. This is the new technology that's available, and available to everybody here. So what I'd like to do now, just for the next 10 minutes or so, is I'm not going to do any MAP today. I'm going to invite anybody who wants to a free demo. But what I'm going to do today, we just don't have enough time to do that today. So what I'm going to do instead today is an exercise to give you a taste, a little bit of a sense of what it's like to live without trauma. We could do that. Even if you're living with trauma now, you can get a taste of it. So that's what we're going to do right now. here's the thing. If we have been living in survival mode, how many have you guys have been living in survival mode and a lot of stress, anxiety, and managing it? You can't even imagine what it's like to live without those experiences and thoughts and worries. And it's interesting, but we actually have to sort of train our mind and body what life is like, not living like that, to live in more ease. So we're just going to spend about 10 minutes just having an experience of that, because I'm sure you've heard this before, but the mind does not know the difference between imagination and reality. So we're going to use a guided meditation, visualization, using the imagination to have an experience of life without trauma, just to give you a taste of that. So it's just going to be about 10 minutes. And so hopefully you're somewhere where you can just close your eyes and get comfortable. And what I want to say before we start is, if your mind is used to worrying, staying on top of things, making sure I don't forget, I encourage you to just commit right now to give yourself the next 10 minutes to let that go, just to have this experience. But just choose, commit, decide, just 10 minutes. And then the mind pops in with, well, wait a second, I can't listen to that. I need to worry about such and such. Where's my to-do list? What am I going to do after this? When it does that, I like to just say, I've learned to just say, it's okay, sweetheart. Just 10 minutes. I'm going to come right back to that in 10 minutes. So just decide to give yourself this time to do that. Okay. So I invite you to close your eyes, first of all, if that feels safe, of course, assuming you're somewhere where you can do that. And also, I know it's noon, so some of you guys might be listening to this at work or in an office space or something, and so it might not be appropriate to close your eyes for 10 minutes. Of course, this is recorded. Please, please, please come back later if you can't actually follow along now. Come back later and give this opportunity to yourself. Again, my hope is to inspire you to take advantage of these new technologies and modalities and create the life that you want, create the ease, create the experiences that you want. Okay, so close your eyes if you can, if it's safe to do that. And let's start with those 4 deep inhales and exhales that I was talking about earlier. So just really slow to the count of 4 in, and then hold for 4, and then breathe out for 4. And just do that 4 times. And while you're doing that, see if you can add in listening to the sound of your breath. And then add in feeling your chest expand or your belly, feeling the air in your throat. And then add in feeling your feet on the floor, getting grounded. And just notice if you already feel things slowing down a little bit and maybe having just a little bit more capacity already. And now, as strange as this sounds, just say hello to yourself. Hello. You can say your name or just hi. I see you. And just do that for a moment. Say hello and see yourself. Validate yourself. Acknowledge yourself. Acknowledge you're showing up here today. Acknowledge all the ways that you show up for yourself in your own life or others. The self-validation is so easy and so overlooked. And now we're going to step into a little bit of imagining. So I want you to imagine in front of you a portal, whatever it looks like to you, just a portal to another reality. And I want you to just quickly hop through, skip through, or gently, whatever feels good, step through this portal. And on the other side of this portal, you are this person who has already taken that action. Taken action to resolve trauma, to be able to integrate trauma, back into your body so that you're no longer living with unintegrated trauma and those impacts. And so in this new version of you, in this new reality, I want you to just use your imagination that you are feeling more peace than you ever imagined possible. And we just use our imagination to bring that in, just whatever level of peace you can bring in. And as you're doing this, just keep breathing. And I want you to stay right in your chair, whatever it is you're sitting on, chair, couch. Stay right here in this moment, in this body. We want to keep it right here. We don't want to see a future picture of ourselves. We want to bring it into our experience right here, right now. So imagining that you're feeling more peace than you ever imagined possible. And in this future moment, just imagine the sun is shining. It's the perfect temperature. There's a little warmth on your skin. And you feel comfortable. You feel at ease. And maybe you even hear, depending where you are, some birds singing in the background. Maybe you're outside or you're looking out a window. And you have time, you have capacity in this moment to notice nature, trees, flowers, the sky, clouds, birds singing, noticing the aliveness in the world, vibrancy of nature, and just imagining that you feel able to stop and pay attention, to take in these details because you've taken the steps to heal trauma and anxiety and to create all this capacity now, this ease, that old need to rush and get things done. It's not here. Instead, there's a sense, I have time, I have capacity. I get done what I need to, when I need to. I trust that. I trust that everything gets done as it needs to. And you're feeling ease and peace, this trust and this confidence that things are happening exactly as they need to, when they need to. And now just imagining if you're able to feel some new level of peace and ease right here, right now, because you've transformed your trauma. What does your whole life look like in this future state? What's your imagination show you? Imagine that you wake up feeling ease. No more waking up with anxiety. Wake up with ease. What should I do today? What do I want to do today? What feels good? What do I want to create with my life today? What if you woke up with so much ease and peace that it feels good and easy to say, what self-care practices am I going to start with? Maybe that's a little bit of meditation or exercise or journaling or eating healthy, whatever, or all of the above. Because you have time, you have the ease, you have the capacity. That old rushing isn't here. That old rushing that is a symptom of trauma is not here. And now imagine in this future state that your relationships are better. They're more harmonious. They're easier. You have capacity to respond in the moment more authentically, with more ease. That old reactivity is gone. That impatience, irritability is gone. You can respond with ease. And there's harmony. You can make good choices. You know that you love yourself and you love others because there's this new ease and peace and capacity in your body. And life, just really feel this if you can, is possibility. There's possibility present in your life now. Now that you're not living from rushing, doing, worrying, struggling, you can actually just think about what's possible. What else is possible? What do I want to create? Imagine a life that's led by that, by possibility and what you want to create. And now let's really take this to the most important place of all, is just staying in this new ease, this peace, this capacity of this new version of you. So I want you to allow in what it is you want most in life. What is it that you want most? Maybe it's an experience, certain experience, maybe, or circumstance, or maybe it's an internal state. But this is you in your imagination, this future you who has resolved trauma, who has capacity now, who has possibility. So I want you to really let whatever it is you want most, let it be here right now in your body, in this chair, in this moment. I want you to see it in front of you or feel it in the center of your being. Whatever it is that you want most. And most of all, let the feeling of having that be present in your body. Notice what you're feeling in your body as you imagine having what you want most. And just let this feeling get bigger. As there's a group of us doing this here together, it can have the impact of making it a little bit more palpable for all of us. So what does it feel like to have what you want? And let that get bigger, more tangible, more palpable. Breathe into that so that you can remember this. And most of all, remembering that if you can feel this right here, right now, today, even though we're imagining a future version of you, you are feeling it right now, right here today, then this is possible. Whatever you're feeling today, right now, is possible. And I assure you, even more is possible as you create more capacity in your body. So just breathing that in. Whatever it is that you want most, this peace and ease. Breathing it into your heart, into your belly. Breathing it all the way into your feet. Seeing it, smelling it. Engage the senses just to make it even more palpable. And if this feels good to you, if this is creating some expansion or possibility for you, remember that you can do this every day. What if this became a practice in the morning or at night? Just getting your mind and body used to more ease, more capacity, to having that, to having what you want most. And there is another magical consequence to this practice, is the more that we practice these feelings, the more our body adjusts to it, the more then our mind, our subconscious mind, draws in experiences that match these feelings. So we also start to create more of this in our lives. So it's a very powerful practice. Just take a few more deep breaths. And then when you're ready, let's come back. Open your eyes gently. Again, knowing that you can go back to this any moment. You can create this right here, right now with imagination. Well, so I just want to come back to the offer that I made earlier that I want to make available to everybody here as we close. So again, what I want to give anybody here is a completely free experience of the MAP healing method. We will do this in a group experience. So what I would love is for you, if you're interested, easiest thing is to message me on Facebook. So my Facebook page is on the screen right now. You're also just welcome to find me any other ways. If you happen to find my Instagram or my website, that's fine too. I check all of these places. So please reach out if you would like to have a completely free experience of the MAP healing method and just to find out what's possible for you or to ask more questions. really excited to be able to offer that and show people what's possible. And once again, I'm so grateful to have been able to be here today and to talk about this. And if anybody has any questions, so I welcome those. I'm happy to stay on a couple more minutes if there are any questions. So I'll just wait to see if any show up in the chat. And as hopefully you're just resting still in that ease that you hopefully were able to access during that guided exercise. And if there are no questions, again, I'm so grateful for the opportunity to be here. I really look forward to hearing from some of you, and enjoy the rest of the summit. Oh my gosh, you get to live this amazing life. You get to make it as amazing as you can. You are free. Sometimes we don't realize that sometimes we're waiting for someone to give us permission to be happy, to relax. We don't need that. This is your life. You get to live it the way you choose. And I'm imagining if you're here on this self-care summit, you're choosing a life that feels good, that feels purposeful, that feels passionate, that feels amazing. So I'm standing with you, for you to have that. Okay, so thank you so much for having me.